Thank you very much, Dalton. I appreciate, thank you everyone for being here. Again, we are getting close to the end of the year. We're getting close to Medicare open enrollment. And following that, we'll have ACA enrollment and again in January for Medicare as well. So as you are aware, there's a lot going on out here in this space, in this healthcare space, and there's going to be a lot going on going forward. Of course, we know the cost of healthcare is not going down. There's a reason why we wanted to do this topic again, because open enrollment is coming up. We wanted you all to be aware of what the changes are and to make the choices that are best for you. Allison, I can't remember Allison how we met, but she has been an invaluable source to me. And she has helped me through some difficult situations, making some Medicare choices for my son. And I'm signing up for Medicare. I just got on Medicare Part A and Part B. And I am really, really involved with understanding these changes. And Allison has also been a great resource for helping me through this process. Um, so what we're going to cover is she's going to go through the Medicare part changes and maybe touch a little bit on Medicaid. And at the end, I'm going to go through the changes for ACA, employer care, things you need to be aware of. The one thing I always do for all of these webinars and my newsletters is point out our QR code. This QR code is specific to us, so that if you look at this, scan this and join our Financial Connect group with all the things going on out there. I want you to be aware of the latest things that are happening in the healthcare space that can affect you. So please scan this QR, join our Financial Connect group. You can throw questions or concerns in there and they will be addressed. Thank you, Dalton, and we can go forward from here. I'm,
Hi, everyone. I'm Allison. Um, we have a lot of slides. Did you send out a copy of the slides before this, or will you be?
We did not before. We'll send them out after, though.
Okay, there is a lot of slides in here. I'm not going to go through them all because that takes way too much time, even though I tend to talk pretty quickly. If you have any questions, you can put them in the question and answer box. I have that over on my screen. Um, but you'll have more information that you'll get when you get this slide deck. Next. Okay, this is educational only. I have to be very specific on that because I have certain rules that I have to follow. There's no plan-specific information that's going to be discussed, but I'm here to answer your questions. I am based in Kentucky, although I'm licensed in a couple of other states, but most of the information with Medicare is pretty general, but things might be a little bit different for your state, so you might want to check on that with an independent agent. Don't just call an Anthem agent or a Humana agent or whatever. Work with an independent agent. The information is going to provide information on Medicare drug plans, Advantage plans, supplements, and even more. Okay, next one. This is our agenda. We're not going through all this, trust me. Next one. So let's talk about the changes that have happened in Medicare so far. First of all insulin, if it's on a formulary, be it a Medicare Advantage plan or a Medicare drug plan, is going to be $35 or less per month, no matter where you are in the different coverage phases. It doesn't mean that all insulins are covered by every plan. So if you take insulin, you'll want to make sure that your insulin is going to be covered by your plan, and it will be no more than $35 a month. My understanding is from people that take insulin is that if you can't take Lantus, maybe you can take Novolog instead. So, if you're willing to make trade-offs like that, then you can maybe find a plan that's a little less expensive. All vaccines, shingles shot, flu shot, tetanus, COVID, RSV, and even more are now zero copay if you have Medicare. And there is no partial extra help. If you get extra help, and we'll talk about that when we talk about the Medicaid, it's now 100%. So everybody gets 100% extra help. And if you are on Medicare and familiar with the donut hole, which is really painful for some people, it's gone. It's gone in 2025. Next slide. Marty, you said you're going on, I see the question and answer, you're going on Medicare in January. So because you're turning 65, you will want a Medicare supplement. And then if you take medications that that are not covered, like they're not an infusion or something, then you'll want to make sure that you go to Medicare.gov, put all your medications in, and it'll tell you which is the best drug plan. No, they are not reinstating the donut hole in 2026, although the catastrophic goes up to right here, $2,100. We're going to go through the coverage limits in the on the Part D drug plan. We'll briefly go through that, but when the cost of what you have paid out of your pocket is $2,100 this year, or next year it was $2,000 this year, then you pay zero for the rest of your prescription medications. And this applies to the ones that you get at the pharmacy. Medicare Advantage plans, if you have one, have to send a mid-year notice because a lot of people don't use their dental, vision, hearing, their over-the-counter benefits. So starting in July of every year, you're going to get a letter if you have a Medicare Advantage plan saying, hey, did you know you had $2,000 in a hearing aid benefit? We don't show that you've used it yet, so that you can use all of that extra stuff. And then the Medicare Prescription Payment Plan, the M3P, we'll talk about that a little bit. If you have really high drug costs, like you have one drug that is like $2,000 and you're going to reach that catastrophic limit like in 1 or 2 months, you can engage in that program with your carrier, and it'll spread that cost over the rest of the year, so that if you have a big upfront cost, you can spread it out over the year so it's not really as painful. Next one. The time you can change your drug plan or sign up for a Medicare Advantage plan is now. Not actually right now, thank God. It's October 15th until December 7th. It's the only time that you can change your drug plan. And it's the only time that you can sign up for a Medicare Advantage plan unless you're new to Medicare or coming off of employer coverage. Part C, the Medicare Advantage plans will change during this time as well. So it is very, 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 very important that you read your annual notice of change that you have from either your Advantage plan or your drug plan. You will receive it by September 30th. If you do not get it by September 30th, then you call your insurance company, the number on your back of your card, and you say, I did not get your ANOC. We call it the ANOC, Annual Notice of Change. There are some plans, particularly here in Kentucky, that are rolling their drug plan into another drug plan. There's one company that's getting out of the drug plans altogether. I think you'll see this across the country. There's a lot of Medicare Advantage plans that are reducing their benefits, changing their benefits. Their copays are higher in some cases. So it's really important to see what changed with your plan and do you want to do something else. So Mike, you are on disability in Utah. There are no Medigap plans. You have to have Medicare to get a Medigap or a Medicare supplement. So unfortunately, unless you're on disability and we're going to talk about this, 24 months after disability, you get Medicare. You have to go out to the marketplace and get your health insurance through the marketplace. And we'll talk a little bit more about Medigap policies and people under 65 because the rules, if you're starting Medicare in December of 25, you need to check with your Department of Insurance or your SHIPs to see if they have plans for people that are under 65. It varies by state. So we'll talk about that when we get to the disability part, okay? Okay, so if you just let your plan ride and you don't do anything, then your plan will just continue with the way it looks next year. So read that annual notice of change. Whenever anybody calls me and they say, oh, should I change my plan? I'm like, did you read the annual notice of change? Because, you know, you need to look and see what's happening to your plan, especially this year. Next plan, or next slide. Okay, so I'm going to talk about some considerations if you have cancer. If you can get a Medicare supplement, that's your best option. There's very little out-of-pocket cost, and there's no network of doctors. So if you have cancer and you're actively fighting that stuff, you want to get a Medicare supplement. However, like Mike, in Utah, they don't have under 65 Medigap policies, which is also a Medicare supplement. So what you'll want to do is check the rules after January 1st, because sometimes different states are rolling in with different things. So like in Indiana or in Kentucky 2 years ago, they had a 6-month period of time that said, okay, if you were on Medicare for disability and you couldn't get a Medicare supplement, then you have 6 months to sign up for one with no health questions. And oh, by the way, the insurance companies can't charge you an arm and a leg more because they were a lot more expensive. Indiana this year did the same thing and said, okay, if you're on Medicare for disability and you didn't get a supplement, you got a 6-month period of time that you can pick one up. So look in your state, see if they're getting Medicare supplements for people that are under 65. And if they do, usually they will have a special period of time that you can pick one up with no health questions. If you don't have under 65 supplements in your state, then your best option is a Medicare Advantage plan, because at least it puts a maximum out of pocket on your costs. When you're on disability, you will be able to get a Medicare supplement when you turn 65, because then you become the quote normal Medicare person. So if you're on Medicare for disability and you're under 65, when you turn 65, the world opens up to you again. So if you're not able to get a supplement in the state where you are, keep watching the rules every single January or December. They'll know by December. Or call your state, your SHIP's office and say, hey, are there plans for people under 65 now? Because usually they will give you a one-time period to sign up for one with no health questions. You get disability automatically if you're after 24 months on disability. You don't need that if your spouse, typically if you are on disability, you're not working. If your spouse is actively employed, that employer has more than 20 employees, and you can get on that group health plan, then that might be your best option. You will not need to pick up Part B as in boy, because the employer health insurance will be primary. And like I said, most states are turning to where they're giving people on Medicare for disability the ability to get a Medicare supplement where they couldn't before. Prescription drug plans and out-of-pocket costs. Does that include medications you get from a cancer center? It depends on whether they come through Part B or Part D. So the catastrophic, and we'll talk, and whoever that is, anonymous attendee, we'll talk about the coverage limits a little bit later on the prescription drug, but there is no 5% of the cost after the catastrophic. When you reach the catastrophic, which this year is $2,000 out of your pocket, next year is $2,100 out of your pocket, then all your meds are free. Okay, and then let me come back to the Massachusetts one. There is no ANOC for Medigap plans because they're standardized by the government and they never change.
Allison,
Yes, you want me
can
to
we go
go
through
through and come
go through
back
it
to
and then
these?
answer questions at
Okay,
the end?
all right,
Thank
next
you.
one, next slide. If you can't get a Medicare supplement, then get the Medicare Advantage plan, because like I said, you have to make sure your doctors are all in the network and that all your medications are covered, but at least it's going to put a maximum out of pocket. If you just have Medicare Part A and B and a Part D drug plan, there is no maximum out of pocket. It's that 20% that you're responsible for. So you will pay until the cows come home. So if you can get a Medicare Advantage plan, then get one. The networks can change at any time. So if you can get a PPO plan, if you get a Medicare Advantage plan, that would be preferred. What we're finding is that PPO plans are getting slimmed down by the carriers because you can go out of network. The copays are higher and the max amount of out of pocket is higher, but and that leaves the insurance companies a little bit more exposed. So what we're finding here in Kentucky is they're either doing away with the PPO plan and only doing an HMO, or they're making the PPOs to where they don't look very good. And so it's going to kind of incent you to not have a PPO plan, but to go with an HMO. An HMO can be good if all your doctors in the network, because you cannot go out of network on a PPO. And if you need help, go to shiphelp.org. See if they, like I do training for the local SHIP's office. So they give my name to everybody if you're have a weird condition or you're on disability. But the local SHIP's office usually have agents that they can recommend in your area that can help you out. And you, again, want to make sure that you're working with an independent agent. Okay, next one. Okay, if you have insurance with you or your spouse's employer, you need to see if Medicare is going to be cheaper, because it depends on how much you're paying for your group health plan. If you're paying, so if you're a couple and you're covered on your spouse's plan and it costs $500 a month, how much does it cost just for you to be on that plan? Because it might be costing $400 a month for you to be on that plan, and it only costs your spouse just $100. How much is the deductible and how much is the out-of-pocket maximum? So if your deductible is $3,000, $4,000, $5,000, and you're going to meet that deductible every year, then maybe if you're Medicare eligible, Medicare is going to be cheaper for you, because a Medicare supplement can have either no copays or only the Part B deductible, which this year is $257. So maybe paying $200 a month to only have $257 in medical costs out of your pocket would be a better deal. So you kind of have to work through these questions to say, how much is Medicare going to cost me? And is it going to be better for me to come off of the employer coverage and just do Medicare? So, depending on what your costs are for your medications, like Paul, if you have $7,000 in a deductible with your maximum out of pocket and your drugs are running that up, it might be better to go with a Part D drug plan and a Medicare supplement, because your maximum out of pocket on the drugs is $2,100 and then they're all free. Retiree or COBRA is not considered credible coverage for Part B, as in boy. So if you are on disability or you're a retiree and you're turning 65, if you or your spouse are not actively working and the insurance you have is based on active employment, then you have to pick up Part B. So if you were a Ford retiree, well, they've done away, but Ford retiree or whatever, and you turn 65, you can't just necessarily, you can maybe keep that retiree coverage, but it's going to become secondary to Medicare because you or your spouse is not actively working. So make sure you follow the rules and pick up Part B when you need to. And if you're staying on employer coverage, and say you're on disability, if you have an HSA and you have any letter of Medicare, be it A or B, you cannot contribute to the HSA. So you can have Medicare and you can use the HSA for your Part B premium, your medical copays, your drug copays, your Part D premium, but you cannot use it for your Medicare supplement premium, but you cannot contribute to an HSA anymore once you go on Medicare. Next one. Okay, so Medicare Part, I'm going to go through these next couple super quick. Medicare is a private fee-for-service. You can go to any doctor or hospital that takes Medicare. Part A is the hospital coverage, and for most people, it's free. Part B is the medical coverage, and it costs $185 a month this year. In October, they'll announce what the B premium is going to be for 2026. If you're getting a little bit of an increase, then it's going to go up, because whenever the government giveth, the government taketh away. And it has a deductible, and then it pays 80%. You're responsible for 20%. Next. Part B. You get this when you turn 65, unless you've had coverage from your employer. If you're on disability, you get it after it's actually 24 months. You get it in the 25th month of being on disability. If you are a high wage earner, then congratulations, you will pay more for Part B. High wage earners, there's 4 levels. It's called IRMA, Income Related Monthly Adjustment Amount. It's based on your tax return from 2 years back. So if you were working in 2023, but you're not working now, and you were making as a single person $150,000, but now you're earning less than 106, you can appeal that IRMA and not pay more earlier if you have a life event like a death, divorce, marriage, a work stoppage, a work reduction, loss of an income producing property like your apartment, your building you rent out burns down. So there's a chart that we have. I can send Diana and Dalton some extra things if you want. But if you just Google IRMA chart or IRMA appeal, you can get that lowered. And your premium might be lower if you qualify for Medicaid. And we're going to talk about Medicaid in a little bit. Your premium is deducted for Part B from your Social Security check unless you're not drawing Social Security, and then it's billed to you quarterly until you start drawing Social Security. And if they're billing it to you quarterly, you can set that up through Easy Pay by going on to Medicare.gov, creating an account, and then when you go to pay the bill, you can just click Easy Pay, and it automatically comes out of a checking account or a credit card every month. Next one. Medicare supplements, they're secondary to Medicare. So Medicare pays first, the supplement pays second. And if you're on Medicare before 1/1 of 20, you can't get an F or a C, which you pay nothing. But if you have one, you can keep it. I'm assuming most people have cancer or have someone on cancer, so you have to pass underwriting if you want to change your Medicare supplement. And if you have cancer, chances are you're not going to pass underwriting. So it's really important if you're going on Medicare or you're turning 65 that you consider a Medicare supplement if you have a lot of out-of-pocket costs. If Medicare doesn't pay, your supplement will not pay, with the exception of foreign travel emergency. And you can change your plan anytime you want, but you have to go through underwriting, which means answering health questions. And rates can be based on your health history if you're not in your open enrollment period, OEP, or a guaranteed issue period. Your open enrollment period is when you first go on Medicare or you first turn 65. Or a guaranteed issue period is you're coming off of employer coverage, or you had a Medicare Advantage plan and you moved outside the service area. There's a number of special enrollment periods that allow you to pick one up. If you're on Medicare for disability, keep watching your state to see if they have a special period at the beginning of the year where if you didn't get a supplement, you can pick one up. Next slide. The advantages are very little out-of-pocket costs. You can go see any doctor that takes Medicare. The disadvantages are the premiums are going up every single year. Now we're starting to see double-digit increases, and the premiums will easily be over $100 versus an Advantage plan that could be $0 a month. Next one. I'm going to speed through some of these because you can read it all later. I want to get to the good parts and make sure I finish on time. Medicare Advantage plan bundles A, B, and D, hospital, doctor, and drugs all into one plan. It's where the government pays a fee to a private insurance company to take on all the risk of Medicare. So you have to pay your Part B premium. You have to live in the service area. They're for-profit organizations, but they have to spend 85% of the money that they take in from the government for patient care and services. So it's not like they're making a lot of money on this. but typically it's healthy people that sign up for Medicare Advantage plans. There's different kinds of plans. We love the alphabet soup in Medicare. So there's HMOs, PPOs, SNPs, givebacks, and MA only plans. We'll talk about those in, I think, the next slide or the next one after that. They'll include extra benefits. So when you see something on the TV saying, oh, you're not getting all the benefits that you could be getting, it's a Medicare Advantage plan. They can have dental, vision, hearing, an over-the-counter allowance, a food card, all kinds of stuff. Everything's going to have a copay. It's not free unless, well, in Florida, gosh, in Florida, they have like zero copays for a lot. I mean, the Medicare Advantage plans in Florida are super sweet, but in general, not so great. These plans are county specific. So every time you see an ad, it'll say, call us with your zip code. Let me tell you what benefits you have. So if you move from county to county, you may need to change your Medicare Advantage plan. So, but if you move within the same city, then chances are you don't need to change your plan. An HMO, you can only see doctors in the network. There's no out-of-network covered except for life-threatening emergency coverage. A PPO, you couldn't go out-of-network, but you're going to pay more. Oops, hold on. My disk is wanting to do some cleanup. And then the only time you can sign up for one if you don't have one is October 15th until December 7th. It'll take effective January 1st. And if you have one, then you can change. You can make one change in the first quarter called the OEP, open enrollment period, to a different plan. So one of the things to be aware of, and that's why you want to work with an independent agent, is plans change their network at any time, but you can't. So we happen to know that the University of Louisville hospitals and facilities here in Kentucky are going to be out of network for 3 different carriers come 1/1. If we send a note out to all of our clients, but if a client goes to the doctor after January 1st and it's a U of L doctor and they're like, we're not in network anymore, then they have a chance to change their plan. But if the network changes in July, you have to wait until the end of the year to make a change to your plan. So it's very important that you look at your plan this year, be it a drug plan or advantage plan. Ask an independent agent, is my network changing? Or call your doctor and say, hey, do you know, are you going to be in or out of network with United Healthcare come January 1st? Just to find out. A lot of times the doctors of the hospitals will mail out a letter to their clients that are affected. Next page. There's different types of plans. HMOs, you can only go to doctors in the network. A PPO, you can go in or out of network. There's what we call SNP plans, special needs plans. A chronic special needs plan, you have to have the chronic disease, like a heart condition, diabetes, cancer, or kidney failure. We have heart, diabetes, and kidney ones here. We don't have a cancer one. There's some ones that are Alzheimer's. So if you're interested in a chronic special needs plan, they are designed for people with that specific condition, and you can enroll anytime during the year. A D-SNP, a dual special needs plan, you have to have Medicare and Medicaid. And your level of Medicaid determines what kind of dual special needs plan you can get. The rules are changing a lot on the Medicare and Medicaid, and we'll talk about that with the Medicaid section. There's give back plans. Oh, you could be saving $120 a year on your Part B premium. If you're super healthy, then maybe getting something where it reduces your Part B premium will be good for you, but the copays, the extra benefits, not as good as a typical plan because they're giving you money back on your Medicare. And then if you have VA coverage or other drug coverage, then you could get a Medicare only plan. You cannot pick up a separate Part D drug plan, which is maybe better for your drugs. This is designed specifically really for people that have veterans and go to the VA for everything, but yet they want the free gym membership or they want some dental or hearing. Next page. What are the benefits I'm not getting? We kind of talked about that. You have to dig into what are those extra benefits and are they really valuable? Next one, we're going to kind of go through these. The extras that you can get, you can see this in the handout when you get it. Go next one. Copays examples, you can see this later. They vary from plan to plan, from company to company, from HMO to PPO. So, and these change every year. And what we're finding is that the hospitals, the outpatient surgery, sometimes the specialists and stuff, the maximum out of pockets are going up across the board next year. So if you have a Medicare Advantage plan, really look at your plan. Next one. The advantages are they can give you different stuff and have very low premiums. The disadvantages, network of doctors, everything has a copay, and they change every year. Next one. Part D drug plan. If Medicare doesn't cover drugs except if you're getting them administered in a doctor's office, or if you're in the doctor, or maybe you have an immunosuppressant drug. So the only time you can get a drug plan if you don't have one, or the only time you can change it, other than you're new to Medicare or coming off of employer coverage, is coming up shortly, October 15th until December 7th. Do not miss that deadline. Do not wait until Thanksgiving. Start early. Medicare.gov does not go live with the information for 2026 until October 1st. So don't go on there now and do a bunch of stuff other than create you a Medicare.gov account and put your drugs in there, but go back like the second week in October after it's settled down and some of the clinks have been worked out, and then evaluate your drug coverage. And there is financial aid available for people with limited income and assets. What you'll find is drug plan premiums are increasing due to the Inflation Reduction Act and the demonstration program. What happened was last year for this year, the premiums on drug plans were going up horribly bad. And so they put a program in place to say, hey, we'll give you money each month if you agree not to raise your premiums more than $35 a month. Well, now they've reduced how much they're going to give the insurance companies to kind of offset that cost. And they're saying now you can't increase it more than $50 a month. So I think you're going to see drug plan premiums are going to increase this year pretty significantly. Next page. Okay, so the deductible next year is $615. You might have no deductible. It might waive the deductible for generic drugs. I don't know of a plan that doesn't waive the deductible for the tier 2, 3, and 4 brand drugs. Once you meet the deductible, you're going to pay a copay or co-insurance, which could be like 25–50% for a tier 2 or 3 or 4 drug, which are the brand drugs. Next page, that's a phase 1. Then you have phase 2 is after you meet the deductible, it's just going to be a percentage of the cost or a flat copay. And there's different tiers for the drugs. The higher the tier, typically the more the copay. Next page. The catastrophic. When you've reached the maximum out of pocket of $2,100, then all your drugs are free for the rest of the year. Everything starts over every January. You have to pay your premium, so that's not included in the $2,100. And it can be confusing because it's either the cost of the medication, what you paid for the medication, or 25% of the cost of the medication. So go to the next one for an example. I'm going to go through this kind of quickly. So if your medication is only $47, and on all the brand drugs, all the things that I've seen so far, no one's going with a flat copay because one carrier got horribly taken to the cleaners on this one. People were only paying $800 total for their medications for the whole year, and then they were all free. They made a huge mistake on that. So I'm seeing that for the brand drugs, everybody's going to a percentage of the cost. But if it is a flat copay, and some of the Medicare Advantage plans still do have a flat copay for a brand drug, then it's either 25% of the cost or your copay. So if the drug is $800, 25% of the cost is $200. $200, not the $47, is going to go toward that $2,100 maximum out of pocket. So there is a chance that you might not actually pay $2,100 before all your drugs are free. The insurance company keeps track of it all, so you don't have to worry about that. Next. The prescription payment program, your insurance company will give you information on this. Basically, if you have, and go then, we're going to kind of skip through this. If you enroll in the plan, then you get a separate bill for your drug costs, but you pay nothing at the pharmacy. So contact your company, your drug plan or your Advantage plan if you want more information on this prescription payment program. On my website, which is imagineinsadv.com, we have on our articles page a webinar where we've taped explaining this whole thing. So go there and watch that. Next slide. Next slide. Why am I getting all these calls? It's all about the Medicare Advantage plans. Next, don't pick up the phone. Don't engage them in a conversation. Hang up. You know what? They're telemarketers and they're used to it. I had someone call me today saying, I saw this video on YouTube. And I'm like, no, it's a no. A Facebook, no, it's a no. No, 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 no. Don't call the 800 number. Call somebody that you trust. Call an independent agent, because they're only going to sell you the Medicare Advantage plan, and they're going to gloss over the bad parts of it and the different parts of it. Don't say, just send me some information, because I don't know how it happens, but you'll get a card in the mail and they'll have enrolled you into the thing. So just hang up if there's a telemarketer. Don't answer the phone. If it's important, they'll leave a message. Next slide. Extra help. Okay, so there's two different levels of extra help. There's extra help and there's Medicaid. Medicaid is a state-run program, and they vary, the limits vary based on which state that you're in. So, and we're going to talk more about Medicaid, but extra help only helps on your prescription drug cost and the premium of your plan. And every October, once they decide what the increase is that you're going to get, this is the current income and asset level for a single and a couple. It goes up if you have more people in your family, but it's based on your liquid assets like checking, savings, CDs, stocks, bonds, IRAs. Goes on your gross joint income if you're a couple, but you can apply through Social Security or do it online. But there is extra help that can help just on your prescription drug plan costs. And then on the next slide, there's also Medicaid, which not only helps with your medication and your drug costs, but could help with your medical costs. So there's different limits of Medicaid. There's the QMB, which is Qualified Medicare Beneficiary. There's SLMB, we call that QMB. There's SLMB, SlimB, which goes up to 120% of federal poverty level. And then there's QI1, which goes up to 135% of federal poverty level. The QMB is full Medicaid and allows you to get the Part B premium paid for and the extra 20%. The SLMB and the QI1 will only pay the Part B premium. It doesn't pay the extra 20%. So in Kentucky, you apply through the Department of Community-Based Services. Call your SHIP's office, Google Medicaid Tennessee, and it'll tell you where to apply. There are also some special needs plans designed for people with different levels of Medicaid. But now what's happening is there's what's called HIDE and FIDE, highly integrated dual plans and fully integrated dual plans. So what that means is if your state has state Medicaid, a lot of states now, they don't do the Medicaid. They kind of outsource it to multiple companies. And so if you have Medicare and Medicaid, your Medicare plan has to match your Medicaid plan. So if you have, for example, I'm going to say United Healthcare because they're all across, a United Healthcare, if there's one in your state, Medicaid plan, then your Medicare Advantage dual plan has to be a United Healthcare plan. It can't be an Anthem plan. So at this point, sometimes they can be different, but by 2030, they're all going to be where they're fully aligned with everything. But again, that's really kind of weird because in Kentucky, if you have Medicare and Medicaid, you don't have a state Medicaid plan. You don't have an MCO, Medicare plan, Medicaid plan. You just have to get a Medicare Advantage plan. So it's kind of different, but the rules are very different between every state on the Medicaid. Next one. So your next steps are read your annual notice of change. Read it. I mean, don't just glance at it and see what the premium's going to be. Look at what the copays are going to be. Look at what is happening in your plan. And don't just throw it to the side and then call your agent and go, hey, should I do something? Because my first words are, did you get my letter? Did you read the letter? If you didn't, read the letter and then call me back, because I don't know. I don't know. If you have a Medicare Advantage plan, make sure you're working with an independent agent, because they'll know if the networks are changing. They've been through the rollouts. I mean, I know things I can't tell anybody, but and I'm going to another one tomorrow, 3 next week. So make sure that you work with somebody. I always say Medicare isn't rocket science, but it's kind of hard to muddle through on your own. Next slide. Create a Medicare.gov account. Put your drugs into there. If you have a Medicare Advantage plan, then you really only use Medicare.gov to evaluate your drug part of your plan, because you need to go look up your doctors, and the doctor part is just as important on an Advantage plan. But make sure you keep it updated there, because it's easier to do. So we have a plan finder tool guide that we're going to put together. We're going to wait till we make sure anything's changed. If you want that, just let me know, and we can email you our plan finder tool guide, which is, it doesn't matter where you are in the United States. The Medicare.gov works the same for everybody. And then I think that's it that I had. So let me go to these questions. Judy, I had a session with Shine, and she told me about a special called the Prescription Advantage. Massachusetts residents, I'm not aware of that. Massachusetts, I think, is one of those places that their plans are a little bit different. I would contact the SHIP's office or your Shine counselor to ask about that. But if they have something like that and it's free, if it reduces your drug costs, I'm all for that. Mike, you're from Utah, and they don't have Medicare supplements in your state for people under 65. You have to be a resident of the state where you're going to get a Medicare supplement. So you can't live in Utah and get one in Nevada if they offer one in Nevada. You would have to move there. I don't want to say this, but I'm going to, because no, I'm not. Okay, so Judy, you were laid off from your job. I'm on COBRA until 2026. You turn Medicare in 4 of 26. Yes, you will want to sign up for Medicare for April of 26. You'll probably want to get a Medicare supplement if you can. Well, you're turning 65, so you can get a Medicare supplement and a Part D drug plan and drop your COBRA, because you're going to have to pick up A and B, because COBRA is not based on active employment. So you'll want to drop the COBRA and get a supplement and a drug plan. If you get another job with credible coverage before you turn 65, then look at what is the COBRA costing you and what is that other insurance. Because, if on the COBRA you've already met your maximum out of pocket for the year, then if you get a job with credible insurance coverage before you turn 65, then you may want to stay with the COBRA instead of starting a new deductible and maximum out of pocket, toward the end of the year. What other parts oh, I missed the rest of that. There was another part in that. Can we undo that one? Oh, it'll be the dismissed. Nope. Can we bring hers back?
It'll go into answered. I can read the rest of it for
Wait,
you.
let me see. Okay. Okay, so if you get credible coverage after you turn 65, you can drop Medicare A and or B. Actually, not A if you're drawing Social Security, but you can drop Part B without a penalty as long as you are actively working, you have insurance through your employer, and your employer has more than 20 employees. So as long as you meet those 3 requirements, you do not have to have Part B. You can drop it, and then when you lose that credible coverage, you can go ahead and you can pick up Part B again without a penalty, and you can do that at any time. You don't have to keep Medicare if you have credible coverage. A is free, so as long as you don't have an HSA, then I would get Part A when you turn 65 because it's free and it might kick in. But once you go on Medicare, if you don't find a job, don't keep the COBRA because it has that high deductible and maximum amount of pocket. Go on Medicare. Okay. All right. And then open. Okay. So, Mike, again, if you have a state near you that has a Medicare supplement for people under 65, then you could do that. You cannot contribute to your wife's HSA, but if it's only in her name, she can contribute up to the individual maximum. But if you have Part A, because you're drawing Social Security, you can't undo Part A and draw Social Security, then she can contribute to the HSA. You can use the HSA for your co-pays and stuff. But if you're on Social Security disability, you have to keep the Part A. You don't have to have B. So you just have to determine and go back through, is it better to stay on the employer insurance or do Medicare, depending on what your costs are going to be. And will a C-SNP cover all cancer drugs? There are some. If the C-SNP is for cancer, it might cover cancer drugs a little bit differently. We don't have a cancer C-SNP in our area, so I'm not familiar, but like on the ones that are for kidney, you still pay 20% of the cost for dialysis. So what I see is they're not that great for that condition, but maybe your nephrologist is a zero copay, instead of a $35 or a $40 copay. So, it depends on whether your cancer drug is a B drug or a D drug. A B drug is like chemotherapy. It's administered in the doctor's office. So that's going to be subject to the medical maximum out of pocket. So if you're looking at a C-SNP that's a cancer C-SNP, you'll want to look at the coverage specific to a cancer diagnosis. And then you're signing up for Medicare, Marty, in January. Should I wait until October for the new rules or start the process this month? No, you do it 3 months before your birth month. So 1, 11, 12, 11, 10, you don't sign up for Medicare until after October 1st. And if you're drawing Social Security, they're automatically going to enroll you in the Medicare A and B, and you'll get your card automatically about 3 months before. If you're not drawing Social Security, you actually have to sign up for Medicare, and you can do that on ssa.gov, the Social Security website, where you just go to, I want to sign up for Medicare. So the new rules, there's not really any new rules it's going to be automatic. If your birthday's in January, it's whatever it's going to be in January. And then my website again, I don't know if I'm allowed to do this, but it's www.imagine, IMAGINE, like insurance, ADV, like advisors.com. And on our art, we have a lot of basic stuff on Medicare on there. I love it. My daughter and I took the pictures, and I just love our website. But go to the articles page, especially after October 1st. The videos that we have loaded up there, those will all get updated when I re-record those. which will be this month. So they'll all be up there the first part of October. But there's some good ones up there now. You didn't answer my question of when I would apply. I'm 73. Oh, yeah. And you've been covered up by your wife's work. So, Paul, what you need to look at is how much does it cost for you to be on your wife's plan? Is she a high wage earner? And are you going to have an IRMA? So if the Part B is just going to be the standard Part B, you can pick up a Medicare supplement at 73. It's probably, and depending on where you live, it's going to be a little more expensive. But you're picking up Part B, you'll be guaranteed for a Plan G. The most you'll pay in medical out of pocket will be $257, and then the most $257, and then the most you'll pay on drugs is $2,100. So if you have a maximum out of pocket of $7,100 and you get close to that, or you're meeting a couple $1,000 deductible every year, yeah, probably Medicare will be less expensive for you. And then Shannon, I'm sorry, you all have cancer. How do I know which Part B and D will cover of my treatments? If it's performed in a doctor's office, chances are it's through B as in boy, the medical part. If it's a prescription that you pick up at the pharmacy, then chances are it's coming through Part D as in dog. I work a lot with transplant people, and so their immunosuppressant drugs that they get at the pharmacy, actually, if they've been on Medicare when they receive their transplant, actually come through Part B as in boy. But think of it in general as, if I'm in a doctor's office or I'm getting an infusion or something like that, it's through B as in boy. If you get it at the pharmacy, it's through D as in dog. And if you have a really expensive drug that's coming through Part D as in dog, go to the manufacturer's website for that drug. It'll say that there's a, help for people with X, it says, oh, if you have Medicare, you don't qualify. Call them anyway, because maybe once you spent $600 out of your pocket, then they'll give you the drug for free. So, with the catastrophic dropping down to $2,100, there's not as many of those out there as there used to be, but talk to your doctor and see if they can help you with a grant or something, because there is some stuff available. And then, do independent agents charge for their services? No, we're not allowed to. So it is we are 100% commission based. The 800 numbers, now they probably get a commission for every policy they sell. So I would not recommend working with an an 800 number. Work with somebody where you can go and they can come to your house, or you can sit down in their office and eyeball them, eyeball to eyeball if you want to, and talk to them. They'll be the ones that are known. But I am 100% commission. We are paid in insurance by the insurance company, a commission. If you call the insurance company directly, you'll still pay the same price. However, this year, some companies have decided that they are making some plans non-commissionable, which means they aren't paying us a commission. In at least where we are, and what I'm hearing across the country, is some of the PPO plans they are not commissioning on. They are commissioning on the HMOs. So, what you'll want to do is ask somebody and, go to the Medicare.gov. That will give you all of your options. So if you meet with an independent agent and they're like, oh, I can't sell you that plan. Well, maybe you want to do a little research and decide, hey, I really like this United Healthcare plan or this Anthem plan. So, go ahead and call United Healthcare or Anthem, or call the company, have them look up all your doctors or your drugs. But, kind of, you can do the Medicare.gov on your own and look at it. The Plan Finder tool, I can send that to Diana and Dalton, and they can send that out to you once we have it updated. If you want the one that we have now, which not much has changed, with it, I can send that out to them and they can send that out to you. But it's something that we ourselves put together for our clients to help them with that. Revlimid, name brand no longer covered, but the generic's not available. Okay, that might be just your specific company or your specific plan, because you need to look at the formulary can differ. So go to Medicare.gov, create an account on there, put your drug in, and then when you click into each of the individual things for the details on the plan, maybe your plan doesn't cover it. But what you can do is you could have your doctor call that plan and ask for a formularies exception. I need to take Revlimid. The generic is not covered or the generic is not available. Usually they don't take away the name brand until the generic's available. But see if there's another drug that you can try instead. But have your doctor call your company and work with them on that. When would I apply? If I've been covered my wife's when at work, but I want to shift to Medicare with a supplement in D. You can do that anytime you want to, Paul. You can come off of employer coverage anytime you want to, as long as the employer will let you off. And I believe I remember you were 72. So, you're expensive for them. They would love to have you come off. So, one of the things to look at is, depending on where you are in your maximum out of pocket with your drugs on your wife's plan, if you do this for 10-1, you can do it for 10-1, but you have that maximum out of pocket of $2,000 for the rest of this year. So maybe you want to make a clean break in January. But it kind of depends. But you'll want to apply for Medicare roughly about 60 days before you want it to start. If you wanted to go for a 10-1 effective date, there's a form her employer fills out, a form that you fill out, you fax those to Social Security to sign up for Part B. Ideally, you do that 30 to 60 days, but it can be done quicker if you want to. For medications given at the office, the maximum out of pocket, if it comes through Part B and you have a supplement, is $257. If you don't have a Medicare supplement, Jennifer, then you're going to pay 20% of the cost with no maximum out of pocket. So if you just have original Medicare and it's a Part B as in boy drug, after that $257 deductible, you're paying 20% of the cost. Sorry. It's my understanding that, most companies do cover generics, but not the name brand. Mike, is that probably for Revlimid? Comes off patent. Oh, for the Revlimid that comes off patent, typically there's a period of time when something goes generic that it'll probably still be listed as a brand drug on most formularies because it's still expensive. As that drug, the longer it stays generic, the cheaper it typically becomes. We saw this with Lipitor when it first went to atorvastatin. It stayed high for a little bit, and then it's like super cheap. So it just depends on when it comes off patent. I still think they still have like 6 months or something, but it's still going to be kind of high in cost for a little bit. And then Jennifer, $34,000 after insurance adjustment of 24, insurance of 16. If 20%, Jennifer, if you have Medicare and 20% of the cost is $1,600 and you have Part B as in boy, or you don't have a supplement, yes, you're going to pay $1,600 every month, which is why you might want to consider either one, see if there's some kind of grant out there or something from the insurance company where you can get that cheaper, or maybe consider a Medicare Advantage plan, because again, if that's coming through Part B as in boy, the Advantage plans have a maximum out of pocket, which might be $5,000, $6,000, $7,000, but it's not $1,600 times 12. Oh my God!
All right,
Is that it?
You did a great job with that.
Okay, so
Got through all of them. Yeah, due to time, I think
Mike,
we're gonna have to
I
close
tell you,
down the Q&A.
Mike, my number's on my website. Will you call me, please? Thank you.
we're gonna have to close down the Q&A there just due to
Okay.
time.
Thank you, everyone. I appreciate it. And watch our website after October 1st, because we'll have a bunch of new videos up there that'll explain a whole lot of different topics. Thank you very much for having me. Hope you learned
Thank you.
something. Thanks.
Absolutely, I did. Thank you. Right. And Diana, did you want to add anything in, or do you want me to just go ahead and start wrapping us up here? Mhm. Well, just want to give everyone a quick reminder about that Financial Connect group that Diana mentioned earlier. Or there's Diana.
Yeah, I'm sorry. I would encourage everybody to go back and look at the webinar that I did back in July. It'll talk about a lot of the changes for the costs associated with the Affordable Care Act or the insurance on the exchanges, and be aware your employers their rates are going to go up probably higher than they have in the past. Again,
Cool.
look at the Connect group. Please scan this QR code and go into our Financial Connect so you can get the latest, greatest information that can affect you.
All right. And then Judy asked, does HealthTree have any counselors that can help out with this? Um, Obviously, we have Diana as a financial coach who is happy to help. Um, what is the best way for people to get in touch with you, Diana?
You can go to, you can request me as a coach on a financial website. I really encourage people to go there. That keeps, because we get grants to do this, just like we are your sponsor through insurance or pharmaceutical companies, it keeps us able to be able to continue doing what we're doing. So request me as
Great.
a coach or request one of the other financial coaches.
Wonderful. All righty. We're going to go ahead and start wrapping up. Um, So as we leave today, we do have that quick short survey. It's just 2 to 3 questions. So just takes a couple moments to fill out, but it really does help us get some good feedback and figure out what exactly we want to cover in the future. And then I wanted to bring up a couple of events that we've got going on for September. We've got this September 10th, taking charge after a blood cancer diagnosis, what every patient needs to know. September 19th, we've got Finding Strength After Setbacks, real stories from relapse and refractory blood cancer patients. So these are both going to be really cool opportunities to hear from members of the community about their blood cancer experience and just have that opportunity to learn from one another. So highly encourage you to check those out. We're also going to be doing several in-person events coming up. In San Jose, Austin, Texas, Spokane. The Las Vegas date will be getting moved. But we do have, these are called Connect to Cares events. They're a wonderful opportunity to meet others from the community, as well as hear from different specialists or different healthcare providers. Occasionally, we do have some financial conversations at these. So if you're in those areas, highly recommend checking them out as they are wonderful events. And then want to give one more special thank you to our HealthTree Central sponsors, Pfizer, Adaptive, Kira, GSK, AbbVie, Amgen, Johnson & Johnson, Taiho, and Bristol Myers Squibb. We wouldn't be able to do this type of work without them, so thank you so much to all of them. And finally, a big thank you to everyone for joining us today, both Diana and Allison, for sharing your time and your knowledge. I learned so much, and I'm sure so many people in the community did as well. This is a very important topic and a very complex one. So having the ability to hear from experts like yourself is really valuable. And then thank you for everyone for sharing part of your day with us and coming here to learn and building this community. We really do appreciate it so much. I've included my email on the slide. Feel free to reach out to me if you have any questions. I'm always available for the community. And I love to meet with you or get you in touch with someone who may be able to better help out. So please don't hesitate to reach out if you have any questions. But I appreciate y'all and I hope you have a wonderful rest of your day.